Treating hearing loss can lower the risk of developing dementia by 60%, but it doesn't work the same in everyone. So in one big randomized control trial published in The Lancet, nearly 1,000 older adults with hearing loss were followed for 3 years. And half of them got hearing aids with real audiology support, and the other half got a health education program. And when researchers look at everyone together, there's actually no clear benefit, but this is where it gets really interesting. About a quarter of the participants were already at a higher risk for cognitive decline and losing ground faster than the rest, and that's where treating hearing loss made a big difference. So same intervention, but completely different results depending on who got it. And one possible reason comes down to what hearing loss is making your brain do all day. Our brains have a limited amount of processing power at any given moment. When our hearing is sharp, understanding speech takes very little effort. The signal comes in clearly, and the brain barely has to work to figure out what someone said. But when your hearing starts to go, consonants are often some of the first sounds that you lose. So 15 and 50 can start sounding the same. But your brain doesn't just hand you a blank, it tries to rebuild the sentence in real time. From context, from lip movements, from what it expected you're about to say. That's part of why hearing loss can go unnoticed for so long. Your brain fills in the gaps before you realize they were there. But rebuilding those words takes a lot of work. Researchers call this listening effort, and you can actually measure it. If something's hard to hear, then people's pupils dilate and their reaction time slows down on a completely unrelated task, and they remember less of what they just heard. They may still understand all the words, but more of their brain power is going into figuring out what we just said instead of remembering it. Now run that all day, every day for many years, and this may explain why the people already at a higher risk benefited the most. If your brain has plenty of reserve, that extra workload may not be enough to show up on a cognitive test over 3 years. But if you're already closer to the edge, taking away some of the workload may matter a lot more. And hearing loss doesn't always feel like hearing loss. It can feel like your memory is slipping, or like everyone around you suddenly started mumbling. So if it's worse in a noisy room, or you're fine one-on-one but lost at a table of 6, you want to get your hearing tested. And I recently found out that Costco actually provides free in-person hearing tests, and I think Sam's Club does it too. And if you Google it, I'm pretty sure you'll find plenty of other centers that can offer hearing tests for free. And if you do have hearing loss and it comes back as mild or moderate, you actually don't need a prescription anymore, and you can get a hearing aid over the counter. So if there's any concern, don't wait, get your hearing tested. It's actually become easier than ever to do that, at least in the US.